Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hello, I'm Rory, and with me is Ken. How are you on this bright, sunny morning, Ken?
Exceptionally well, thanks for asking, Rory. You have tuned in to the Counselling Tutor Podcast. This is episode 132. We have 3 topics that we're going to be covering today, starting off with getting an assignment referred. If you're on a formal training course where you're submitting assignments, it is probable that at some stage during your studies you're going to have that referred. We're going to be looking at what kind of feelings that can bring up, and Rory's going to be sharing some of the top reasons why assignments are getting referred and how you can avoid those. We also have our section called Check-in with CPCAB, where Rory, you spoke with Heather Price, and the topic, I believe, is speaking about how different it is when you're practicing skills in a classroom setting, maybe with a peer, and when you're out actually practicing with real clients and using those counselling skills.
Yes, it's a real window into the practice-based counselling and how that is different from using skills in a classroom setting. And Heather very succinctly gives us some insights into what we may have to consider, or what students may have to consider when they're working with real clients, what they need to have in the back of their mind, that the differences may be when they're working with real clients as opposed to working with their peers in the classroom. It's a must listen to, really. It's really, really interesting topic.
Thank you for that, Rory. And ending episode 132 today, we're going to be speaking about working beyond your competence. This is an important topic, whether you are a student just about to go out on the road of counselling, or if you're a qualified therapist and you've been practicing for many, many years. Your competence level, understanding what that is, and what do you do when you find yourself with a presentation that is beyond your competence level. So, good topics. Let's start off getting an assignment referred. Surely this never happens, Rory. I'm sure all our listeners are going, oh, that's never happened to me.
I got every one of mine referred when I did mine.
Yeah, I got a good few.
I had to write mine in batches eventually. But yeah, through the course of studies, there's very few people who get assignments referred. Who don't get assignments referred. And it can bring up some real feelings of, being a failure, or not understanding, or frustration, or anger, because people put a lot of effort. Even the ones that I've marked and referred, I acknowledge that people have put a lot of effort into them, even if they haven't hit the dreaded criteria. So I think the first thing is to normalize the idea that at some point you will get an assignment referred, because unless you're used to academic writing, or are really fortunate in really understanding what the criteria is asking of you, at some point you may get a referral. And I think there are some common reasons why people get referred. And of course, the first reason, Ken, is not answering the question, which is a classic case where there's a piece of criteria that asks you something specific and the person answers another question.
Yes, no, definitely I can relate to it, having had some assignments of my own referred, and of course tutoring for a while and having a need to refer assignments on occasions. And I guess just a definition, if you're wondering what does refer mean, maybe you're not based in the UK and you use a different word. It's basically when assignment is put in and a part of that assignment doesn't quite hit what is required, and it's handed back and you're asked to revisit that assignment. And it's very different from a failure. So I look back to my school days and I would get tests back with a big F at the top with a big circle around it saying, try harder, Kenneth. And the referral is not a failure. But I know that when I had certainly my first referral, that it brought up the same feelings for me as a failure. I thought that I had failed. I thought that I had done it wrong. I thought that I was not good enough. And this is not the case. So it's about maybe understanding what a referral is, Rory. And I know you've marked more assignments than you've had cups of tea, and that's a lot. So share with us kind of a little bit more detail on what it is.
That is saying something, Ken, isn't it? And and I used to get see me on my assignments, fail, see me, and in red. And of course, we don't know marks in red. When I did my teacher training, they forbid us to use a red pen when marking because it can bring feelings up. And you're absolutely right. And of course, what we're talking about here is transference, where people bringing in maybe feelings from the past when they're educated at school, and bringing it into the here and now and getting those really uncomfortable child feelings. And the reason that people get referred is usually because they're not answering the question. And it can be very tricky with criteria. They usually ask things like examine or analyze or describe. And it's those words that really people fall down on. So if you ask to describe something, so describe a loaf of bread, and then somebody gives you a paper that's got a list of all the different types of bread, that's a list, it's not a description. So I think one of the things I'd say to people is when they get their assignments, look for what we call the kind of trigger Bloom's verb, which is describe, analyze, evaluate, and go to that first. Have a look what evaluation means or describe means. And as you move up the higher levels, so when you move from 2 to 3 or 3 to 4, or for our friends in Scotland from certificate to diploma, you'll be asked kind of more tougher questions that you'll have to think more about. So a list is the very basic that we're asked to do. Make a list. It's what you say to children, isn't it? Make a list, and they make a list. Then right at the end, you've got critically analyze, which is where you've got to draw lots of different information in to form a view of how you've critically looked at something in depth and made a criticism of it. And that takes a lot longer. So my top tip here is look at the verb. It can be describe, analyze, evaluate, discuss. Find out what that means first before you start your assignment.
Yeah, if in doubt, ask your tutor to explain it and explain it again until you feel confident that you have that. We do offer at Counselling Tutor paid for service for students of counselling. It's called the Counselling Study Resource. And within the Counselling Study Resource, we have an extensive study help section where we discuss this in great detail, how to hit criteria, all of the Bloom's verbs, as you've mentioned, Rory, and how to understand what they mean. And you I think you hit the nail on the head where you said so often an assignment is referred not because the person doesn't understand the topic at great depth, not because they haven't given it their all, but just because they have missed the understanding of how to answer that question. And when you were talking about the describe a loaf of bread, if you were asked in an assignment, describe a loaf of bread, and then you went into the whole process of describing how the bread is made, whether that it's flour and yeast and water and that is combined together, you're 100% right. That is how bread is made, but that wasn't the question. The question was describe a loaf of bread. That would be the size, the color of it. Does it have seeds on the top? Is it spongy? So it's about understanding how that question is asked. And I guess if you do get anything referred and you've got something that comes up for you, the personal development group is a great place to take that in and share it and say, this is how I'm feeling. If you feel safe enough to do so in your learning institution. And another outlet for that would be our Facebook group, Counselling Tutor Facebook group. We have tens of thousands of students in there, and all the time people are sharing about their study journey and the difficulty of the study journey, as well as the wins. We celebrate the wins together, but it's so heartwarming to see so often where somebody will share a struggle they've had in assignment, a struggle they're having with their studies, and people will just pile in with understanding, recognition of what they're going through, and guidance and advice sometimes from tutors, supervisors that hang out in our group. And you can find our Facebook group just going onto Facebook and typing in the word Counselling Tutor. We're right there.
Yeah, absolutely. No better place to hang out if you've got a referral or if you want any other kind of conversation about the world of counselling and psychotherapy. And in terms of getting a referral, some practical advice that I can offer is read the feedback. Anybody who marks an assignment should put in really solid feedback and have a look at the feedback and with the feedback, it should give you very, very strong clues on what you are missing out. Sometimes it's just the smallest of things. It's heartbreaking when you, from a tutor's perspective, to look at someone's work, look at how all the effort they put in, and just realise that for a couple of sentences that you have to refer them. It's really, really, really hard. And you have to do that because you have to keep up academic consistency. So read the submission and read the feedback. And the other thing is, if you have your documents on Word or any kind of word processing, as it used to be called, don't think you've got to rewrite your whole assignment again. That hardly ever has to happen. All that's probably needed for you to do is have a look at the feedback. You may have to put a couple of sentences in, or maybe references, but hardly ever does anyone have to rewrite their entire assignment. You know, when Ken and myself was at school, we used to write it with was it a quill and an inkwell, Ken? If you have a feather and an inkwell, it probably wasn't that old, but we used to have to write them. And of course, if you got your assignment referred or anything referred, you had to write it all again. It's like a bit like a punishment. You know, not only have you got it wrong, but you've got to spend all that time rewriting it. And of course, you know, with modern technology, sometimes it's just a case of just restructuring a sentence or revisiting what the verb is. Is there enough description in there? So don't lose heart and remember that I think there's nobody, I don't know anybody who's never had an assignment referred. So there we go. That's my observation. Don't lose heart is what I'd say.
Like it. So moving on from assignments being referred into the practicality of skills, practicing of skills with peers versus actual working with clients. And we're going to be checking in with CPCAB with Heather Price that you spoke to on this, Rory.
Yes, Heather gave us some valuable insights on how to adapt your skills practice when working with clients, and the things that you may not think about. This is the key thing. Things that come up that you may think, I didn't really think about that, because you're so used to working in an environment where all your peers know the rules. Little things like, stopping on time. You know, if you're doing skills practice, most people, certainly when you get to the higher levels, will set their own time boundaries, even if they're the speaker. So they'll stop on time. Clients don't. Sometimes you have to kind of interrupt, which can feel quite kind of rude and not kind of therapeutic. But sometimes you just have to stop people just so you're getting an understanding of what they're saying. But Heather outlines it wonderfully. So let's have a listen to Heather.
Check in with CPCAB.
Hello, and we introduce Heather. How are you, Heather?
I'm very good, Rory. How are you?
I'm very, very well, thank you. Very well indeed.
Good.
So today we're going to discuss role play versus real play.
That's right. Yeah.
So it's quite a big thing, isn't it? Because doing skills in a class is totally different to doing it in front of clients. And I think that there's a huge difference, and there's some things that sometimes don't become apparent. What's your view on that?
I think overall there's a place for both, because sometimes certain client situations, let's say, don't always present themselves through students in a class. So they might not be having the opportunity to practice with some content. So that could be introduced as a role play by the tutor. But equally, a lot of students say, I don't like acting. I don't want to do role play. I want to use my own real stuff. So there's pros and cons, I think, really.
Yeah, so if we take the kind of role play where a tutor may kind of set a scenario that someone has to work with, I guess they can be useful. It can prepare people for scenarios they might not have in class, such as someone not being quiet, or someone who keeps changing the subject, or someone who's maybe a bit rude.
Yes, yeah. or keeps crying, or is very angry, or has a certain situation, like say is going to take their own life, that sort of thing might not come up in their actual client work, and it probably won't come up in class. So there can be a good space there to have a role play on those particular scenarios.
Yes, you've given two really good examples of things that may never come up in client work. And one of those is someone who may be thinking of taking their own life, which is something that every student should really be prepared for, really.
Yeah, they should know how to deal with that. So practicing through a role play example might be a good way of doing that if it's not come up in their actual client work. And I think another one that comes to mind is child protection issues, child safeguarding issues. They might not always come up in the student's actual client work, so they could come up through role plays. Yeah,
absolutely. And I think you've made a really good point, because sometimes, as tutors, we have to hope for the best and prepare for the worst, is what I used to say to my cohorts. And occasionally part of that is to look at really the worst case scenarios. And you've given two real worst case scenarios: a child protection issue, someone who may be taking their own life. Are there any disadvantages, do you think, to role play?
Well, I think the students generally tend to say they feel they can't get into the emotions quite as well as if it was their own stuff that they were talking about. They have to perhaps imagine more what that person might be feeling as the client. But in my experience, I think if they look upon the role play as just being a framework for a skills session, most people can call on their own emotions, even if they've not had the same scenario. There's usually some depth of feeling there that they can call on, put it into that scenario, and make it as real as they possibly can. So their trainee who's playing the counsellor has still got something kind of meaty to work with, if you like. So I think that's what they would say would be the disadvantages. It's harder to get into the actual emotions.
Yes, and sometimes people might run out of backstory as well.
Yes.
Trained actors are really good at creating a backstory for the characters they play. But, unless you've got someone with thespian tendencies, maybe, you're training someone, you're absolutely right. It's hard to hit those emotions. But I guess in terms of, worst case scenarios, what we're really teaching the students is assessment, making a risk assessment, assessing risk, thinking about the procedures that they need to work with, the law, policies and procedures. So this really is kind of practicing for when the worst situation happens. It's the assessment tool more than anything, isn't it?
Yes, knowing what to do, who to refer to, who to go to, that kind of thing, as much as working with the actual emotions of the person. But then I also think that at level 4 particularly, then students should know how to get into someone else's frame of reference for a short time. So if they've got a scenario, then imagining how that person might feel, as if they were working opposite that person, shouldn't be too difficult, really.
Yes, I mean, I can think of some people who I taught who did role plays around inventing things, and they kind of ground to a halt in some cases. I was observing one where someone was obviously role playing, and the person who was working with them just ground to a halt. She said, "I just don't know who this person is," and it was because I suspect that they were working with something that wasn't real. So that's something to be thought about, I guess.
But also perhaps outside of their experience, so they didn't really quite know what to do with the role play. And sometimes they don't always know in which direction to take it. But then that also happens with real play, where students can be using their own stuff, but actually go off at a tangent or go maybe much deeper than they intended to. And then it's working outside of the competence of the trainee counsellor. So it can kind of happen with both sets of skills practices, I think.
Yes. Do you think there's any disadvantages about working with real material that students bring? Anything that we need to be, tutors maybe, or even students need to be thoughtful of?
Well, I think if they're not prepared at the beginning of a session to bring their own stuff, they can sometimes find they come out with something which is maybe uppermost in their mind at that time, but where they can easily feel very vulnerable because they perhaps haven't thought through, what's this going to be like when I start talking about it in this, and it's a make-up session, but it's my own stuff that somebody else is dealing with. How's that going to feel? And because they get to know their classmates really well, they can sometimes be tempted to perhaps go more deeply than they perhaps maybe really should. So the trainee counsellor can't really work with that, or they get themselves into deep water and then think, oh, I wish I hadn't disclosed all of that in my training group. So they perhaps need to be prepared. And I think also sometimes I used to find that the students might think they've got several different issues going on, but actually quite a few of them run into one another, and it tends to be much the same issue week after week.
Yes.
Which then is not very good practice material for other people.
Yes, and I guess it's at times like this where the astute tutor may be taking the students on one side and saying, I've just observed your skills, the person working with you, and, you seem to be talking about the same issue. Have you ever thought of accessing your own therapy?
Yes. Well, yes, there is that. Absolutely.
Yes.
Yes. Yeah. But it can be quite useful if tutors prepare the students beforehand and ask them to write down things that are uppermost in their mind that they've got some emotional attachment to, that would be in keeping with the level that they're at in their training. Just jot them down and keep a list. And then when they've used something, they cross it off the list. When something else occurs in their life, they can add it to the list. So they've always got a kind of rolling list, the rolling stock of things they might talk about.
Yes, and I can hear the scribbling of pens because we do have a lot of listeners who are tutors, and I'm sure I can hear, ooh, that's a good idea, right, and it is a great idea, and of course I think any skills practice, be it a role play or working with someone's real emotions, needs to be fitted in some form of a contract that's usually done as a class contract at the beginning, or maybe a contract between the person who's listening and the person who's speaking.
Yeah, because sometimes the students will say, well, I don't mind this triad hearing my personal stuff and what's going on for me. So that's the counsellor and maybe an observer, but I don't actually want this to go out to the rest of the group. And so you're right, to make contracts in that way can be a very useful thing to do.
Yeah, it's fascinating, isn't it? The different forms of skills practice. One, as we open with, which is a rehearsed one, where you can use it to really help students overcome worst case scenarios and hurdles, and to get them to think on the feet a bit, and to think just outside of maybe the theory. They may have to do some administrative tasks or may have to alert someone, and also working with the real material with someone, again, about how much people are opened up, how safe they are, where they left. It's an interesting process.
Yes, it is. Yeah, I mean both things, real play and role play, are both interesting things to use at different times, I think, and maybe it's for tutors not to be afraid of using both of them in equal measure, and particularly nearer to where the students are doing their external assessment, which at level 4 is going to be a role play, so that they are prepared for that when they've perhaps been spending some months up until then working with real clients where it is very different. And it is a little bit of an exam technique, but if the tutor has used role play all the way through and at levels 2 and 3 as well, then it's not going to be a completely alien thing.
Yeah, so the message really is a good mixture of role play and working with someone, with real emotions is very useful. And it starts really at the earlier levels and goes all the way through the levels right up to level 4. So Heather, thank you so much for sharing that really valuable insight about role play and real play.
Thank you. Thank you very much.
Check-in with CPCAB is proudly sponsored by CPCAB,
the only awarding body run by counsellors for counsellors. To learn more about CPCAB qualifications and to get more detailed information on today's podcast topic, visit cpcab.co.uk.
Well, as always, just so useful. Just listening to Heather just reminds me of just the transition that we have to make as students from working in a classroom with skills to the real world of work. And talking about the real world of client work, you see what I did there? What I did there was linking into things that can happen, and that's sometimes working beyond your competence. Now, if you're a student counsellor, almost certainly you will be seeing clients that have been screened by someone. Someone will have done an assessment, assess the client, and they'll be allocated to a student depending on their experience. That's how it should be done. But even with that kind of assessment, and certainly for someone like myself who's in private practice, who assesses clients myself, sometimes you can work with a client. The initial assessment is, yes, I can work with that. And then all of a sudden, the client discloses something and you realize that maybe you may be out of your depth. So what do you do? And more to the point, what kind of ethical protocols do you need to consider when you're making that decision? And so the first thing I would say is that you need to understand your ethical framework. You need to have that embedded in your practice, depending on which ethical board you're with, but you need to understand what your ethics tell you. And also, there is no shame whatsoever in thinking, I don't think that my knowledge base extends as far, or my practice experience can support this client. I've had it in my practice where I've worked with clients where I've identified that they really do need a different form of help. And in that case, it was a case of really, really thinking about how best to support the client, and also not just to say to the client midstream, I just don't think I can help you. I think your problems are far too big for me to deal with. That's absolutely what we'd never, ever do. If we have to refer on, we always say, I think my level of skill is probably isn't what you need. You need to work with another professional who has a different kind of skill set to help you, and to have some kind of referral process already in place. So, it could be referring to a GP, it could be referring to a colleague, it could be referring to another service. But absolutely, before you make any form of referral or speak with the clients about this, you need some kind of solution for them or some kind of signposting. It's not good enough just to say to them, well, I think my skill set really doesn't match what's going on for you. Come back next week and I'll try and sort out something for you. That isn't, the client will go away thinking that they can't be helped, that even the counsellor or the therapist has been defeated by their problems. If their problems are that big that the counsellor can't help them, what hope is there for the client? So you might need to consider that. But also, in some cases, if your level of, if you find yourself not understanding, you may be able to gain CPD. And this is crucial. CPD is a big part of what we do as therapists. And it's certainly a big part of my practice life. I spend a lot of time studying and doing courses and speaking with other professionals and reading periodicals and all sorts of things that make up CPD. And sometimes you can, if there's something you don't know, you can find out about it just very quickly. And that's the balance. If the client discloses something, maybe say it's about drugs, clients using some form of street drugs, and you're not sure what that is, you can, between now and the next week, look that up. That's CPD. Have a look, go to an authoritative website, or speak with a colleague who may be experienced in working with people with substance misuse, and you can get a really good insight, and then you can work with the client the next week. So it is a balance, and it is really working out, I think, in your mind, can I learn enough, while working with this client to be able to support them, or are the client's difficulties something that another professional really needs to get involved with. And it's something that should be on the top of your thinking, I think.
Yeah, it's an interesting topic, working beyond your competence. I guess the first stage of that is understanding what your competence is. And as you say, Rory, doing regular CPD, updating yourself, learning about different kinds of presentations. But there's also, for me, as you were kind of going through that, there's an area of greyness here, and I recognize this from being a supervisor, seeing supervisees who might bring a client in and say, "Oh, I don't think that I can work with this client," and they will explain why they don't feel they can work with this client. And in hearing their explanation, it is not a client that is outside of their competence. It is a client that is outside of their comfort zone, or they're feeling feelings of incompetence. They're feeling imposter syndrome maybe with this client, because the client is maybe saying to them, but I'm here for answers and you're not giving me any answers. And there might be a person-centered therapist. And if that knee-jerk reaction is, "Oh, I need you to now refer you to an active directive therapist because I'm non-directive," that's not always in best service of the client. So a good rule of thumb is, unless it is an obvious one, unless something is glaringly obvious, it is something that you can take to supervision. Go and discuss it with your supervisor, get a real perspective on it. And as Rory has suggested, do some CPD on the presentation and look, can I work with this? Is it ethical? Look to the ethical framework. Is it ethical for me to work with this? And then go back in. And the reason I suggest this is because very often in counselling, the relationship is the vehicle, really. The relationship is difficult. Sometimes a client will come in and it's difficult for them to trust, and it takes time. And I guess if somebody comes in and on their first session they mention something that you obviously see you can't work with, it's not that difficult to say, that you've presented with today, I don't feel I am fully trained, but I've definitely got a colleague who might better fit for you. That's going to be a lot easier on the client because the relationship has not built. The client has not shared maybe deep secrets or parts of their past with you on a level that is deep and meaningful, opposed to if you are 6 to 8 sessions in with this client and a client brings something and you've built that relationship. Because I get it that we have we do have an ethical obligation and we must refer if we are working outside our competence. But at the same time, we need to be mindful of the relationship and what that means to the client, how disrupting it can be for them emotionally. It's tricky, and it's worth having a think about that.
Absolutely. And I think probably a lot of people are listening now thinking, well, what kind of examples, Rory? Well, I'll give you an example. You may be working with a client who says, I'm really lacking motivation, and you work with them for 4 or 5 sessions, and then they disclose to you that they're using huge amounts of cannabis every day. And of course, we know that with cannabis, one of the things that happens is that people can lose motivation, and also there's a strong evidence that people can become quite paranoid using the very strongest strains of cannabis, and that would lead a practitioner into a bit of an ethical situation, because is it the cannabis use that needs to be addressed first? And if it is the practitioner skilled enough to be able to work with the cannabis use? And also, and this is the key thing, does the client want to alter their use of cannabis? Because it might be they don't want to. It might be they say, well, I'm fine. So you might have to find yourself in a conversation where and I've had this conversation many times as a practitioner, saying what you're telling me about your cannabis use would indicate the reason why you feel the way you do. And maybe if you reduced or stopped using cannabis, you would feel better. And I know as a therapist that you can do any intervention or, work with someone very empathically, but actually it may be that they need to address the drug use first and then look at the issues that are in their life. And that's a very tricky balance. And as Ken rightly pointed out, you need to take supervision and, have a reflection on what your strategy may be to work with this client. And if you need to refer on, how are you going to do it?
And it's that how. Well, first, just touching on the example you used there, great example, Rory. And if you look to drug workers and you look to drug rehabilitation, the work in drug rehabilitation is that the drug use is addressed first, and only after that, that's called primary treatment, and then there is secondary treatment that after the drug use has been addressed, and that would usually be a 3-month addressing the primary cause, the drug use. Then only would secondary treatment start looking at the emotions and underlying reasons that the person finds their life in chaos and kind of putting the pieces back together. So great example there. And it's that how do you do that? You know, if you find that you're deep in a relationship, that the relationship is built, you find yourself suddenly working beyond your competence, how do you do that? And I've had a number of times in my own practice where I've needed to do that, and I got some great advice from my supervisor. Again, that just shows the importance of taking it to supervision. And what you can do, and you can, if appropriate, recontract with the client to handhold rather than work therapeutically during the transition phase. And the reason I say that is very often, if you make a referral to another service or another practitioner, they may have a waiting list. There may be a waiting time. The person seeing you may already have had to go through some kind of a waiting list or a waiting time before getting to you. That can be weeks or months, depending on how you work and the setting you're working in. And if you then have a situation where you need to refer them on and they've now got another 3 months that they have to sit without any kind of contact from anyone, it's almost like that connection they had has been cut because they now have this factor to their presentation. If appropriate, where you can, obviously it would need to comply with your agency rules and regulations, you can do hand-holding. And I've certainly done that with a client who presented. Something came up that was quite clearly out of the realm of counselling and psychotherapy and needed mental health practitioner to step in. There was a waiting list, and I was able to be with that client, not in a therapeutic way, just in a hand-holding way, so they had someone to be with them while they were waiting for that waiting list. And it was very, very useful. It was interesting, you know, when we deliver therapy, and clients will often come back and say how that changed their life. Just the hand-holding, just being there, Rory, was so therapeutic, even though it wasn't therapy for this client, and they really appreciated that.
Yeah, you may, again, another great point, Ken, because sometimes, this, what they call pre-contemplation in CBT, where someone's thinking about thinking, just to have someone supporting them through that phase so they can go and get the treatment that they may need or they may want, can be very useful. So yes, there is a role for therapy, but you do have to be very, very thoughtful that if you've contracted with someone around a particular presentation, and that presentation is driven by something other, an external factor such as alcohol or drugs, or maybe a generic mental health difficulty, that you think about referring them to a qualified practitioner. And to help you out with that, there's a handout that you can click on. And you can click on that handout. And if you want that handout, it's available for you now. It's go to our website, counsellingtutor.com, find the website, the podcast tab, click on that. And if you hit podcast 132, which is this podcast, it's there for you. Just click on it and we'll download that into your inbox. Some observations about working within your competence. And what a great podcast. I've really enjoyed this one. We talked about what happens when you get your assignment referred and how you may be able to work through that and, just see the light at the end of the tunnel. In checking with CPCAB, we talked about the transition from using skills in the classroom to using the skills in a real world situation and how those differences can be really, really stark. And then finally, we talked about working within your competence, making sure that when you're working with a client, you're competent, you're ethical, and also you're offering the very best possible service to them. And as always, stay grounded and stay safe.
Take the stress out of your counselling studies and get the support of Rory and I by joining us in the Counselling Study Resource. Counselling Study Resource, or CSR for short, is the world's most comprehensive assignment guidance and study support resource for students just like you of counselling and psychotherapy. See how Counselling Study Resource can help you. Visit counsellingtutor.com. That's counsellingtutor.com.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.